Welcome everybody to tonight's webinar. We're going to talk about feeding the growing horse, and when things go wrong, what can we do? So, why is it important to worry about feeding growing horses? Well, just like it's important to worry about what you feed your kids, because one day they're going to be adults. One day they're going to be the athletes that you bred them to be, and you want to set them up for success. We know that when they're young, they have a lot of rapid growth, whether it's skeletal growth or muscular growth. And anytime that there is rapid amounts of growth going on, we need to make sure that we're feeding enough nutrients to actually support that growth. So before breeding, before you even think about putting the mare with the stallion, we want to set that mare up for the best chance to actually get bred and to so we have that fertilized egg turns into a little embryo, and then that's going to have to implant into the uterine lining, and then they'll grow a placenta around it. And we know that before and after that implantation, which is absolutely critical, and in a lot of horses that is the kind of cause of early embryonic loss or failure to maintain pregnancy. We know that calcium, iron, copper, zinc, um, cobalt, iodine, manganese, selenium, vitamin A, B vitamins are all important for uterine health before implantation, supporting that embryo, and then after implantation as well. So when you decide that you want to breed a mare, that's the minute that you start to think about her nutrition, and then that will indirectly affect the foal as well. So before you ever even put her into a breeding program, you want to make sure she's in the right body condition score. You want to make sure she's getting all the vitamins and minerals and nutrients, that you want to make sure she's got good gut health, because gut health is going to boost her immune system. 70% of her immune system starts in the gut. So making sure she's on something like DDA will also improve her chances of getting bred. So feeding the foal in utero. Most people think about feeding the foal once it's born, but you're really feeding the foal in utero. You're feeding through that dam. In early gestation, that less than 6 months, you can see the heart is developed. You can see in the little graphics on the side there. We've got an eye bump, we've got blood vessels developing, a tail nub, we've got nostril ridge, eyelid, stifle, elbow, ear, heart, as I mentioned, they're all being developed in that early window, less than 40 days. The heart is developed between 18 and 20 days. And we know that zinc, copper, vitamin A, and vitamin D are really critical for heart function and development. So um, it's too late to wait till the foal is born to think about feeding the foal. We need to make sure that we're feeding that mare with all of the nutrients she needs to maintain her own body condition, but also additional nutrients so that she can pass those through to the foal, because you are already feeding the foal. The minute she gets pregnant, you are feeding the foal. Mid-gestation, we're looking at months 7 and 8. We start to increase our energy and protein requirements, especially on a mare that may be a little harder to keep. You might notice here is when she starts to drop off some body weight, because she's starting to put a little bit more of that energy and protein into that growing fetus. Um, you can see there liver, heart, kidney, brain, lung, bone, all of the minerals that are being used, and then the vitamins. Vitamin A comes up a lot, vitamin D, vitamin E. These all come up continually as really critical for fetal development. And in that late gestation, we're looking at 9, 10, 11 months, we get the majority of our tissue and muscle laying down here. We're gaining a lot, about a pound a day. But one of the other things that we're doing, and if you've heard me speak of this before, you know that we are laying down vitamins and minerals into the fetal liver. We're fortifying the fetal liver with nutrients that are not available in mare's milk, so that once that foal is born, they can draw on those fetal liver stores while they're reliant on the mom for milk before they start to consume enough of their own grass and feed to consume those minerals. We'll see in late gestation an increase in energy and protein requirements. That's primarily fat and muscle that they're laying down on the foal. But it's absolutely critical to continue to maintain and vitamins and minerals. Now, sometimes we have an overweight mare, and we know that fat mares, fat any kind of fat animal, fat cows, they actually have a higher rate of dystocia, of difficulty birthing. So you don't want them too fat to birth. Um, and so if we don't need to feed a lot of extra protein and calories in the late part of pregnancy because we've got a mare that maintains her weight really well, don't mistake that for her not needing those vitamins and minerals. Some mares I can take all the way through pregnancy on just a vitamin and mineral supplement. Whether you're doing DAC Orange, Total Performance, Breeder's Choice Plus, or you're using a ration balancer without any additional calories and a good quality hay. But we need to make sure that they're getting vitamins and minerals. So when we think about an early bone, if we the main issue that we have with young growing horses when we think about the problems that they develop is bone issues, or issues developing that bone. And so you got to kind of understand how bone actually develops in order to understand how that turnover from cartilage to bone may break down, and that's where we get those issues. So in the fetus, we primarily have all those limbs are cartilage. All of the bones, what are going to be bones, limbs and structures that are going to eventually be bones, start out as cartilage. And there are cells called osteoblasts, and they live in the cartilage, and they turn cartilage into first spongy bone, and then eventually that spongy bone gets turned into harder, compact bone. But first it's spongy. If you ever cracked a chicken bone in half, you see that really spongy bone in the center. You can see here at the top, we've got the blue is representing the cartilage, and right in the center of that long bone, those osteoblasts start creating some spongy bone. They start turning some of that blue cartilage into spongy bone. And then you can see on the wall of that long bone, we'd start to see some more compact, dense bone being developed. So we're starting to get less and less of that spongy bone and more compact bone. But that is the process. So cartilage has to get turned into spongy bone, then hard bone. And it's that turnover of cartilage to bone where breakdown occurs. So you can see here in the late fetus and very early neonate, we see we've got all spongy bone in the middle, but on the ends, you can see that we've still got cartilage around the ends and we get spongy bone in the middle because that's what's going to eventually turn into the cartilage on the ends of the bone, turns into a different type of cartilage, but also we end up with that growth plate. And so you can see in the late neonate, you've got that. It's a much big, wide piece of cartilage, but very late term. And then as they are born, what we're developing is you can see a growth plate there, that light blue cartilage. On the end, that light blue cartilage actually has turned into what we call hyaline cartilage. It's a more dense cartilage that protects the ends of these long bones. And then we also start to see a bone marrow cavity develop in the middle. So in an adult horse, this is what the bone looks like. We've got that bone marrow cavity in the middle. We've got the harder, dark black shell bone on the outside. We don't have any growth plates on the end anymore. We've got still spongy bone on the ends, but on the very, very ends, we have that hyaline cartilage, that fine layer of shock absorption that stops bones rubbing against each other, that gives some protection from the end of the bone in a joint so that they can rub smoothly together without friction. One area where we see problems is in that conversion of the cartilage on the ends from that more light blue squishy cartilage into the hyaline cartilage, or in that growth plate. So we grow bones also from the middle outwards. Um, and in a normal situation, new cartilage is formed at the same rate that cartilage is replaced by bone. So the turnover from cartilage to, so we're creating new cartilage, but we're turning cartilage into bone as at the same time. And so it should all happen at the same time. So we never get too much new cartilage and we never get too much bone. It's all just turning over at the same time. But if there is an issue there, then we'll end up with more cartilage being developed, kind of pushing bone out of the way, or um, we'll get pockets, and we'll end up with pockets that will break off, and we'll see that. This is a growth here, so we're growing from the middle of the bone all the way out, and that causes the growth plates on the ends. That growth ceases. So those growth plates are allowing the bone to continue. They're there. You say, why do they need the growth plate? Why is it there? Because you notice that bone on the left is shorter than the bone on the right. The growth plates, remember how bone is formed? Cartilage turns into bone, cartilage turns into bone, cartilage turns into bone. And so in order for a bone to get longer, cartilage has to turn into bone and make it longer and longer and longer. So up until they're mature and they don't need their bones any longer, they need to have cartilage in the middle of that bone in order to make it longer and longer and longer. It's why an adult, they don't have any cartilage there. They can't grow any. You can't grow bone. You can't, like when we get osteoarthritis and we get all these bone degeneration issues as an adult, you can't just grow back healthy bone because the cartilage is not there. That went away when you were young. You can see there's no growth plate there, so we're not growing that bone any longer. Now, I find this graphic really, really interesting. And I think that we have to take this into account specifically when we're thinking about what we want to do with these animals. Um, because it doesn't matter whether you're Western or English or within those disciplines, what you're doing. Um, Everybody seems to want to have horses mature younger. The earlier that we can put them in futurity classes, or the earlier we can race them, or the earlier we can do young horse jumping or dressage classes. Um, you know, everybody's trying to rush growth. And get them to mature earlier, and that really is not a great idea. And so it's kind of like their bones mature from the ground up. So the bones in their feet, they're mature at birth. The coffin bone, the pedal bone, they're mature. The navicular bones, they're all mature at birth. Then you can see the bones in their fetlock at around 6 months of age. Those are mature. They're not going to get any longer. You can't say, oh, at 2 years of age, oh, my horse's fetlocks have grown. They've gotten so big. No. By a year, they're cannon bones, full length. They're not going to get any longer. 2 years of age, their knee joints, knee and hock joints are fully developed. Now you can see the bones in the hock joints 3.5 years. So the hocks actually do take a wee bit longer than the knees. But then you can see as you go up the leg, the femur, the radius and ulnar, They are looking at 3 years, and then up into the kind of shoulder of the horse, we're looking at 3.5 to 4 years. The spine, what you're going to sit on if you're riding the horse, is not developed till 6 years of age. The kind of spinal processes right where the wither is above the shoulder blade, they are the very last to develop. The jawbone is not, the lower jaw is not developed until 5 years of age. So when you think about riding a horse or doing a lot of circular or sideways motion with horses, you've got to think that up until 6 years of age, they're not fully developed. So um, I think about barrel racing horses or cutting or reining futurity horses, um, having a lot of sideways torque, especially on the upper part of their shoulder, that can actually be really damaging. So let's think about these growth disorders. We've talked about kind of how bones develop and when they develop, when they're mature by. But growth disorders, it's kind of the word that everybody's worried about when we have young growing horses. Developmental orthopedic disease. It really is not one thing. It's an umbrella term that covers all kinds of different growth disorders, from osteochondrosis, fasciitis, angular limb deformities, flexural deformities, cervical, so up into the spine malformations. Any kind of growth abnormality can come under a developmental orthopedic disease, right? It just means growth bone disease. Most of them result from a failure of that cartilage to bone conversion. What happens is cartilage production outpaces conversion of cartilage to bone. So we get these chunks of cartilage kind of filling in spaces where bone should be developing. And cartilage is not strong, bone is strong, and it becomes a weakness. Osteochondrosis is where that cartilage is not retained. It actually breaks off. Um, Oftentimes we'll see an enlargement in that growth plate because that is cartilage. And we've either got too much cartilage being developed there. So remember, we're growing cartilage, we're making cartilage, but we're also then trying to turn that into bone. So when we're growing these bones, we don't want to make more cartilage than we're turning into bone. We want the amount of cartilage that's being made to be the same as the amount that is being turned over and created into bone. So we want that to be exactly the same. So the seesaw is not going up or down, it's just staying super balanced. And so we can either get too much cartilage developed in that growth plate, or we can just get inflammation in that growth plate as well. So on the left-hand side, that crack is representing that growth plate. And you can see in a normal horse and versus fasciitis. Itis is just any kind of inflammation. So we've got inflammation of the growth plate in the physis, which is the joint that is the knee. So two common time frames, because the other thing that I don't know this off by heart, but there are certain time frames where if a client comes to me and says, well, my growing horse has developed some lameness. We aren't quite sure where it is, but we ask, what's their age? And we say, well, they're 4 months old, or they're 8, or they're 12. Based on the age at which it happens, we can typically then back calculate which joint is affected. So fasciitis, when we're at the 4 to 8 month old range, we're really looking in the fetlock. They might have open knees because, again, we're still growing there. But in the 4 to 8 month old, typically we've got issues in the fetlock. 10 to 18 months, you can see in this foal really open knees. That is the time frame that we're really focused more on the development of the knee joint. Oops. And so I mentioned that if we are looking at the end of the bone now, so a failure of that bone on the end, the cartilage on the end. Remember that cartilage on the end is going to turn into that hyaline cartilage. What can happen is you can actually get too much cartilage or a necrosis of the cartilage. So if there's necrotic cartilage, then that's not going to turn into bone. It's not going to do its job. And you can either get on the left-hand side there, you can see a flap right there. So we have articular cartilage right on the end. It didn't turn into bone. So we have this hole here, this blip in the end of that bone, and that can either flap off, oops, oh gosh, flap off and cause an OCD lesion, or we have it goes up into the bone and we have this cyst up into the bone. So either an OCD is that flap that'll flap off of the cartilage, or if it actually protrudes more like a pimple, a big pocket up in there into the bone, then that's a cyst. So osteochondrosis can affect the cartilage in the articular surface or the growth plate. The most common place for these OCD lesions is in the stifle or the hock joint. Most common site for that bone cyst. So remember, the OCD was that flap, and then the bone cyst was almost looked like the pimple pocket. And the bone cyst is primarily in the femur or fetlock joint. So you can see in the radiograph on the left, there's just a little divot there in the end of that bone. It should be nice and rounded. And if you look at it, actually, what it does it look like? You can see that the cartilage isn't necessarily broken, but you can see that there is an indent there. So the bone behind there has disintegrated or not developed, and that is an OCD lesion, one type. Okay, so what on earth is causing this? Well, let's talk about the things that we have less control over. Now, we can control all of these, but we obviously have a little less control over genetics. Um, you can choose not to breed to a stallion that throws a lot of genetic OCD abnormal growth abnormalities. But sometimes it's just that particular pairing between that stallion and that mare that creates these genetic abnormalities. You may not have even known. It might just be bad luck. Injury, there can be some kind of bang or stress to that joint. Stress or mechanical, let's say you have a foal that the mother just runs and runs and runs and never lets it stop, then all of that pressure and all that running is going to cause a lot of inflammation, and that inflammation is then going to interfere with that cartilage to bone turnover. Some disease states also can decrease immune function, and if the foal doesn't have enough nutrients just to try and stay alive, then they're certainly not going to have enough nutrients to feed, because everything, all of these functions in the body don't just happen. They have to be fueled, whether it's creating a heart or growing bone or turning cartilage into bone. Everything has to be fueled. Nothing just randomly happens. So if you've got a foal that doesn't have enough, is sick for whatever, let's say salmonella, streptococcus, whatever, sick, and they're putting all of their nutrients into just trying to stay alive, then they're not going to be putting extra nutrients into fueling healthy development and growth. Okay. And then the one thing that we have 100% control over is nutrition. We control what we feed the mares. We control what we feed the mares before, during, and after pregnancy. And therefore, we're controlling what that foal is getting through the mare and then what the foal is getting after um, birth as well. And we know that nutrition is just one part, but it has a huge implication on the development of orthopedic disease. Nutrition mistakes are amplified. Like, I can make a little mistake in an adult horse and you're never like, oh, okay, an adult horse gets a little less copper than they're supposed to get. You're not going to notice anything. A foal that's growing gets a little less copper than it needs. then that could have dire consequences because feeding mistakes, nutritional mistakes, are amplified when the foal is developed. It's like um, my analogy of building a fence. You know, once the fence is built, I ran out of nails once the fence was built, and so I wasn't able to, one of the boards popped a nail, but it still had one nail holding it in. I ran out of nails. I couldn't put another nail in it. It's fine. It's fine. I can go to the store and get nails later. It's a built fence. It's totally fine. When I'm building the fence, though, if I run out of nails, I can't build the fence, right? So when you're building anything, you need to make sure you've got all your tools and all of the lumber, everything you need to create that structure. Rapid rate of growth. Rapid growth gets a really bad rap. Like we all trying to slow down growth to try and avoid these developmental disorders. Here's the deal. You can have rapid growth. You just need to make sure that it's even and that it's supported with all the nutrients that your horse needs for that elevated growth rate. So we now have to feed even more nutrients because we're sped up growth. And one of the big things that people do is take out protein. Oh, protein's going to cause growth problems. No, I will guarantee you, if you feed a bunch of energy and your foal is, or you're not even feeding a bunch of energy, they're just getting a lot of energy out of the mare's milk, and they don't have enough proteins to support laying down all of that extra tissue, they're going to have problems, right? Protein is not the enemy. It is actually the savior. And it's just like we all know about calcium, phosphorus, we know about copper and zinc. Protein and calories go hand in hand. You can't have more of either one, okay? So, high energy without proper support from protein or minerals and vitamins, that's an issue, right? Protein is not a problem. Poor quality protein is a problem, so not feeding good quality protein. That's why I say alfalfa is great for young growing horses. Trace minerals, not enough calcium, too much phosphorus, not enough zinc and copper, too much zinc, low manganese. All of these things are a problem. If you look at this little mineral wheel, it's why anyone who hyper focuses on one nutrient is crazy. Or you can't just focus on the amount of zinc you're feeding your horse or the amount of phosphorus you're feeding your horse, because look at all the interaction. Zinc interferes with magnesium and phosphorus and copper and calcium. And so you can't hyper focus on any one mineral. They all need to be fed adequately. So with looking at the timeline again, um, of possible causes of these developmental orthopedic diseases, so nutrition. Um, Under 8 weeks of age, if we see an OCD or a DOD, let's say that one of these developmental orthopedic issues under 8 weeks of age, the possible cause could have been an older mare or a mare with placentitis. And why I say an older mare, because their placenta has gotten a bit thick and it's a little harder for nutrients to be able to cross across that placental barrier into the foal. So either they've got an inflamed placenta or it's really old, so it's thick and hard to kind of strain nutrients through. So that would mean that the foal wasn't getting enough nutrients. Or if it's not an older mare and we don't have placentitis, maybe the mare's mineral intake during pregnancy was low. Okay. Maybe she was a fat mare and we decided we got to bring her body weight down a little bit and we didn't give her all the vitamins and minerals she needed. Some observations that you might notice in an under 8-week-old foal. They're toppling over, they're over at the knee, weak foals, not milking well. Um, and or the mare's diet was rapidly altered during that pregnancy. Okay, so we're under 4 months. So that's under 8 weeks, newborns. Right now we're under 4 months of old age. What might be a potential for disaster? Well, maybe the mare's got a boatload of milk, right? If she's got a boatload of milk, there's a lot of calories and protein being pumped into that foal, but the fetal liver didn't know the mare was going to have a boatload of milk. And the fetal liver's only got a certain amount of minerals and vitamins stored in it. And so they're going to get used up real quick. If you notice that your foal is growing quite rapidly, most likely because the mare is an excellent milker, we need to provide uh, additional vitamins and minerals without any additional calories because already getting plenty of calories. Notice that I said I'm not cutting back the calories. I'm not restricting that foal from drinking or nursing from the mare. I'm just making sure that I provide plenty of vitamins and minerals additional. So this is that foal that at 30 days of age, I'm going to get it on colt grower. I'm not waiting till it's 3 months of age. Weanling to yearling, if their ration's not balanced right, we've weaned them. They're not reliant on their mare anymore. So if their diet isn't balanced, maybe they're just getting hay, or they were getting a mare and foal feed, but not quite enough of what they need. You need a top dress for something like colt grower, again above average growth rates, and above average growth rates is not the problem. The problem is above average growth rates and you not providing them the nutrients they need to support that growth rate. But we also don't want fat foals. That just puts a lot of extra pressure onto those joints. So we need to ensure that they're getting all of the vitamins and minerals, whether that's you adding colt grow or that's adding a ration balancer. If they're on a mare and foal feed, they need to make sure that they're getting all those vitamins and minerals. Um, if we have issues and we are slow to try to correct them, I shouldn't have slow growth or reduce energy there. What we can do is actually wean the foal. 3 months of age, you can safely wean a foal. It does mean a lot more intense management on your behalf, but you certainly can wean them that early, which then decreases the amount of calories that they're consuming, and you 100% control everything that's going in to their body. Colt grower, primary vitamin and mineral at that point. I also recommend DDA as well because that's going to help them to absorb out of the hay that they're getting. We know that we've seen studies looking at the yeast that's a primary component of the DDA, helping with phosphorus digestion and things like that. So horses are often switched from a rich hay to a grass hay. But I think we've got to be a little bit careful with that because in doing that, you can sometimes decrease the amount of protein that they're getting below what they need. So we still need to make sure that they're getting, if they were getting a really rich high calorie hay and we switch to a more meadow hay, lower nutritional value, I still like to keep in some alfalfa to maintain the protein, the good quality protein content. And then, okay, so marine derived calcium. We've talked about that. We talk about it a lot from a gut buffering standpoint. And we don't talk about it as much from a bone formation standpoint. But the marine derived calcium, the calci powder that's in Purina's Outlast, but also in our pre-buff, in our Cool Gut, in our Breeder's Choice Plus, in our Colt Grower, that marine derived calcium actually shows when animals are fed that, we can see significantly more of that. So osteocalcin, we talked about the osteoblasts before, those little cells that turn cartilage into bone. osteocalcin is a hormone in the blood that is a biochemical marker for bone formation. So the more osteocalcin you have in the blood, the more you're going to be able to turn cartilage into bone. And in those falls that were from dams that were fed the marine-derived calcium, they had a much higher amount of that osteocalcin, that marker that showed how quickly they could turn cartilage into bone. So that's really significant. In exercising yearlings, 2-year-olds, this study looked at different planes of bone density, and the red bars represent a supplement they were being fed that contained the marine-derived calcium versus just plain calcium carbonate. And the bone density in those thoroughbreds being exercised was significantly more dense when they were being fed the marine-derived calcium. So that being in the Breeders' Choice Plus and the Colt Grower is significant. Here's another thing. I talk about obesity a lot when we're talking about metabolic syndrome, when we're talking about performance, but obese animals, whether it be cows, pigs, horses, it really is not ideal. And this study looked at maternal obesity, increased insulin resistance, inflammation, and osteochondrosis lesions in foals and yearlings until 18 months of age. So having a fat dam during the pregnancy significantly affected the foals all the way through 18 months of age. So it really is important not to grow that fetus in an environment where the dam is obese. So this study looked at 24 mares, normal and obese. Obesity increased the inflammation in mares and foals. 53% of foals born to obese mares developed OCD lesions up to 18 months of age. If that is not a reason to not have a fat mare, now of course we don't want to have a super skinny mare either, but do not have a fat mare. Fat is not the best color. It will, if you have a thin mare, chances are you're just going to have a wimpy little foal be born, but it's probably not going to have a lot of issues later on in life. If you have a foal born from a fat mare, number one, we're going to have dystocia issues, foaling issues, but that foal is going to be affected all the way up to about 18 months of age. All of their growing life is affected. It can also affect colostrum quality and fatty acid concentration in the milk. Obesity during pregnancy in horses affected placental structure. So that's how well they can absorb nutrients from the dam, as well as colostrum and milk fatty acid concentration. That's a big deal. So obesity during lactation caused the mare's milk and colostrum to have more inflammatory markers and an altered fatty acid composition. Fatty acids like omega-3 fatty acids. Decreased ability to tolerate heat stress and increased incidence of OCD. Okay, and then finally, early life gut bacterial community structure. The microbiome in your foal's gut predicts disease risk and athletic performance in horses bred for racing. Now, this is just one done for racing, but this is kind of where we started seeing a lot more research about the microbiome, the bugs in the horse's gut. Now, we know a foal is born with no bugs in its gut, right? And they develop that from their environment, nursing on the dam, eating manure. They develop this gut bacterial community. And that, how well they do that and how quickly they do that is an indicator for their disease risk and athletic performance. So if you're breeding horses, not just for fun to make pretty animals, but you're breeding them to be athletes, it's about 20, I think it's between 21 and 28 days of age. That's the window where you need to make sure that they have developed an ideal gut microbiome. So that's where we came out with the foal starter paste. So this was really groundbreaking research that these folks did. It was a 3-year study, 52 foals, and they took fecal samples every day from 2 days of age to a year, and then followed performance through 3 years of age. So when they're looking at fecal samples, they're really looking at that microbiome, right? And they showed, and they looked at orthopedic disease, respiratory disease, soft tissue problems, as well as the diversity of bugs in the gut. And they showed that when they had a low diversity, so a poor microbiome, that was significantly associated with a higher incidence of respiratory issue, orthopedic disease, and soft tissue problems. So the fall starter pace, that's really where the idea came from. It's critical to get falls off to a good start. Disease and diarrhea can cause death, so limited immune function. What can we do to help? And it's not, you know, what can we do to support what they're already doing? How can we get ahead of it and make sure that we create the most ideal microbiome in the ideal window? And so in the fall starter paste, we've got the bovine colostrum. It gives immunoglobulins to help immune function and control inflammation. We do not want inflammation in these babies. Um, we also have the GI Pro 3, the PHN GI Pro 3, which is that pre-pro postbiotic. And the main thing that the GI Pro 3 does that no other probiotic or postbiotic does is it interferes with bad bugs talking to each other, right? So Clostridia, Rhodococcus, Salmonella, Streptococcus, they can't take hold because that GI Pro 3 doesn't let them proliferate, right? So maybe there's a couple of little Clostridia bugs, but there's never a big army of them because they can't recruit and replicate. Biomoss. So biomoss we know from Alltech is a prebiotic that also binds up bad bacteria to help good bacteria. So it's not really interfering with the communication. It's literally putting this mucous membrane around bad bugs. And then yeast, which is a yeast, helps to establish normal gut bugs. So helps to feed those good bugs. Glycine is an amino acid that helps to reduce inflammation and promote tissue repair. So if you've got a little sick foal, the first place that their tissue is going to be inflamed is in the gut, and we need to repair that super quickly. L-glutamine is an amino acid that helps with gut repair and immune cell function. And then beta glucans from yeast wall, they stimulate the immune system when the animals are stressed. So your immune system is like a fire engine sitting in a firehouse. It's waiting. It's always ready. Until the bell goes off, it doesn't kick into gear. And a good immune system, the way to measure a good immune system is how quickly that fire engine gets out and puts out a fire, right? It's sitting in there waiting in the shed. How quickly can it get out the door and put out the fire? That is the measure of a quality immune system. And so by feeding all of these things, by kickstarting that immune system and stimulating that immune system, we're getting that fire truck out the door faster and giving it more water to put out the fire. So we're really with the beta glucans helping to activate that faster. With the newborn foals, we recommend 1 tube every day of life. So it's a minimum of 3 tubes, day 3, 4, and 5. We say 1 tube a day. Some people, as we've been, using this for 2 seasons now, they're like, well, why not days 1 and 2? Obviously, if the foal is sick, yes, give it on day 1 and 2. But this product, we don't want to just feed to sick foals. I want you to feed it to healthy foals as well because I want you to kickstart that immune system. I want you to develop that microbiome from the ground up. But I don't want you to interfere with the natural bond of the dam and the foal and that natural colostrum transfer. So that's why we said day 3, 4, and 5. 3 consecutive days prior to stress, like if you're going to vaccinate them, travel, trim, weaning. So let's say you're going to ship the mare with its foal off to get rebred. You want to do three days of foal starter pace. Or if the foal gets diarrhea, 1 tube a day while the diarrhea persists. Now, if you have a foal heat diarrhea, that is a hormonal diarrhea. There's hormones in the mare that are going to be transferred to the milk. There's no bacteria, there's no sickness in the foal. It's a hormonal diarrhea. So it's not going to stop foal heat diarrhea. So, mare nutrition is key to foal health. In utero, we need to be making sure we're feeding that foal adequate nutrition, strong, healthy foals. Utilizing the Breeders' Choice Plus because it's got the chromium in there, which is boosting immune system. It's got the calcite in there. It's got elevated selenium and vitamin A, all these things that are going to boost the mare and that foal in utero. Then colt grower, 30 days of age on the colt grower if we're worried about growth problems. 3 months of age if we're not worried about growth problems. We want to get those foals on the colt grower. Something like the CMZ paste. So copper, manganese, and zinc are the primary nutrients that are involved in cartilage development and turnover. So that's why we have the CMZ paste if we have issues with that cartilage to bone turnover. Therapeutically, we're using that when we have issues. It's not something that we're just randomly feeding every day. It's when we have issues. And then obviously you can use something like the yucca if you want to decrease a little bit of inflammation, but the full starter paste when they're really young. Okay. Any questions?